You're listening to Let's Talk AI.
Good day and welcome to Let's Talk AI. Today's guest is Helen Chen, Professor of Practice in the School of Public Health Sciences. Welcome, Helen.
Thank you to having me here.
Yeah, excellent. Well, it's really great to have you, and I'd like to launch in and figure out who's Helen and what got you into this whole direction. So how did it start for you? How did you get into AI?
Yeah, okay. So first, probably you have to say how I ever even get into the health at all. I have 3 degrees trained in engineering. I have a PhD from our civil engineering quite many years ago, and so for computing, right? So at that time, we study using computing to study the structures and to study how the system interact with each other. And for my particular PhD, I study with Professor Wayne Broadland, and to understand how the biological cellular level structure interact with each other. So from there, you can see that I wandering through into the School of Public Health. At that time, it's public health and the health systems. I studied from actually understand how the information is managed in a massive information systems used by the hospitals, by the imaging labs. That's how I started. But eventually, especially with the COVID, we all know data is just so important. So now we have a digital public health. The school changed its name quite recently of School of Public Health Sciences. Now we view the data. It's governing our individual data all the way to the population level. And from the healthcare and the public health, now we don't really make such distinction because data use is that continuum of can use at the individual level and also at the population level, right? So there's a massive, massive data, and we basically, without the advanced computing technology such as machine learning, and we just don't cannot really understand the data anymore because it's so multifaceted and so vast amount of data. We need to make sense of it.
Excellent. So this term public health versus health, what is the difference? What does that really mean? Public health versus health.
Okay, so normally you see the continuum of the health spectrum. You started from ensure you have a good general, even just a hygiene and the living condition. You have a clean water to drink. You have vaccination to fight against the polio, for example, right? So those ones are traditionally becomes a domain of public health. But now, in the way that in the past and healthcare is this gigantic hospital or a long-term care facilities, we dealing with the treatment of a disease. But there is actually the health promotion and the creating a better health condition. So that is a public health domain, and all the way to the care for the precision medicine to target a particular gene to cure the cancer. That's traditionally very much of the care domain. But now we realize it's a system that we have to start it from preventing the disease to even from just happening, all the way to cure the disease at the personalized treatment. So that's all the way now we realize the data can be used and we need to think systematically rather than a very specific, this is for hospital, this is for public health unit, right? COVID actually is a very good case to show the public health and healthcare, and it's absolutely a continuum. It's very tightly connected.
So at the core of all of this is obviously data and information,
Yes.
and
Yeah.
this term health informatics, data informatics. So if you could elaborate further, what is that all about?
Yeah. So the health informatics is a term probably being officially come into the vocabulary somewhere around 20 or 15 years ago. At that time, mainly focused on how we deal with the electronic patient records and the patient medical records, that how we capture them, how we store them, how we present them, and how we derive the intelligence, so to speak, the insight, right? Even just doing a Power BI on the side, it's just like doing a spreadsheets, charts, and to say how many patients going through my ER department today. Those ones are the data insight derived from those data, and is we call that how our health informatics deal with.
Okay, so you took the word insights. I want to dig in on that. Are these insights for at a regional hospital level? Are these for high level governments to figure out like who's hungry for this data?
Yeah. So the so-called insights, okay, so sometimes we actually take the intelligence a little bit too mysterious. The intelligence or insights, it's actually started very much from how many patients I have today. Okay, so that kind of even just using Excel sheets to see what kind of patient and how many nurses are working in my wards and how many patients are currently occupying the bed. So those ones are insights, right? All the way, so there's a 7, 8 layers, it depends on which model you look at, all the way to saying we call the prescriptive modeling or AI, to say if I have a particular goal, I want to have, so like in the cancer treatment, for example, if you say I want to minimize a certain adverse effect, then tell me, based on all the data you know, based on all the cases you know, what would be my best kind of a treatment path I can go. And while on that treatment path, if I actually my condition change, right, it becomes kind of a new starting point in any next step to decide what's the best treatment for me, then that is where the insights will come and driven towards a goal, but actually continuously draw this kind of insight. Who needs this kind of insight? As a patient, definitely I need it, right? So when I go in the public too, and just like giving the COVID case, for example, I need to know how many people probably in my neighborhood have the case, my local hospital, and my own condition, whether my symptoms leads to how risk and pointed to the certain disease or certain chances I have COVID, and whether I should go or not to test. So those kind of insight the individual needs to know. But you all know that your caregivers needs to know, right? So among the type of patient and or among the type of population I'm caring for, and I need to know well according to these conditions, what kind of decisions I need. So the University of Waterloo, for example, we care for the students and the staffs and the faculty members here. So our insights of the data were informing us of this kind of operational and decisions for us. But of course, at the national level, WHO definitely needs to know those insights. But it's at a very different level.
Right.
It's at a population level.
So, we don't have to beat around the bush. COVID is obviously front and center on this whole data and data informatics. How did you get started in the COVID data? And I noticed you've just put out now a paper on this after the second lockdown. So let's start about the COVID, and then we'll talk about your paper in a minute.
Yeah. So COVID is a very interesting case. As a public researcher in the public data domain, and you can see that the insights from the data revealed is informing the national and the worldwide decision making at the society at a scale probably we haven't seen before in the history, right? Before, we cannot collect so much data and in so short time and near real time, and in the massive scale. And also you can see that the society react and to this crisis, and with kind of a week by week and a day by day type of number to inform us that what we should do, what is the best path. We charter this very unknown path. That is actually a data-driven decision-making process, and it's in real play. Okay, so that is where everybody is dealing with the data, trying to understand the data, and would being come to action, right? So that is our duty and our interest as well, and the golden opportunity of looking at data, because never before so much data available to us and at such fast speed. And the government, Ontario government, Canadian government, and the worldwide, and they actually put together, immediately released a lot of data, and for the researchers to make sense of it. So that's where we, of course, and join the force and of this understanding the data.
So obviously, I'm guessing University of Waterloo is not alone on this. Are you working with other universities collectively?
We that is a community, not really belongs to a particular university. So you can see that for example, U.S. government and announced this cargo data sets and the data challenges. They released make free of all the possible, like the publications related to of that period of time, and then just actually asking the researchers come to meet the challenge and to say if there's any insight you can offer to the society. I think Professor Jimmy Lin, and he answered such challenges as well, and he had his share of his contribution. I think he's featured some earlier on. But that's a similar thing. We look at the data, we look at actually social media data, we look at the hospital data. We're actually trying to make sense of it. And also currently we are working on the infovilance system, and is trying to make it a systematic way that we can detect certain signals and anticipating, have an early warning sign next time to say if there is another pandemic or public crisis, emergency coming upon us, we will be a little bit better prepared. And using the data we can have, I can tell you what kind of data we find is useful, but any data probably is useful.
Excellent. So I'm going to now focus in on this recent paper you came out with, Public Attitudes During the Second Lockdown, Sentiment and Topic Analysis. What was that about?
Okay. So that for that paper, and I have to actually track back to our previous paper, and which in the very beginning of the COVID, and there's some very fast release of information, and the people are just writing paper like crazy, right? So then social media. So you can see that we use, in the second paper, we also use the social media. Social media is a very interesting platform. And as we can say that, especially during the COVID-19 cases, and then there's a massive amount of opinions and the informations was disseminated on the social media. And the social media for certain generation or group, that's their only media. They will never go to watch CBC, right? So that's only media. So it is a powerful tool for us to communicate, but it also can be a curse that lots of misinformation and half the so-called, I'm using the earmark quoted, kind of half-truth, kind of, there's no half-truth, truth is truth, but it's kind of, they blended some kind of a fact, but also some speculation and some half-truth, intentionally not truth, and to actually disseminate or just spread like a wildfire in the social media. So in the beginning, we just thinking, what did people saying about, what the social media say about us as a society? What did they say? So we did a systematic review and of what the social media the researchers and using the social media, all kinds of social media as their data, right? The data they post it on social media, and to see people's attitude and what people is reacted to the government's responses and how they feel about this, going through the whole very stressful situation. So that leads to the first publication to the Lancet Digital Health publication. And it's been cited almost quite widely, and the people continue to say, the people just feel that, yes, this is an important topic, and the WHO in turn actually paid lots of attention in the infodemics. They call that the pandemic, this time the COVID-19, not only the pandemic of the disease, but it's also the pandemic of the information, because there's so many things there. So they basically, that term of infodemics has been, so my students and actually they even go to the WHO special training of, actually this is a task force deal with the infodemics, right? So that's how to get us into it. But as an engineer, as a researcher of data, of course we not just review somebody else's paper, but we also want to do something of our own. So we started to look at if we can get a Facebook data, if we can get the search Microsoft data. Harold, you know that you have made some connections even with us with Microsoft, right? And the Google trained search data, they are all available and openly. Microsoft is not. But then we actually look at the Twitter and looking at the Reddit, and we look at, eventually I want to look at the YouTube and the imaging, audio, and all the things. And as you can see that the social platform is as the way we voice our sentiment, voice our reaction, and actually voice our opinion of anything, right? And so in the pandemic situation or any public health or healthcare government initiatives, you want people to speak about it. So that is a platform we cannot ignore. But dealing with those kind of data is extremely massively messy. So in the time in my first 10 years, and I deal with healthcare data, actually I continue to deal with the healthcare data and look at the clinical notes and cancer recurrence rate detection, etc. But compared to social media, and those very, very challenging, top challenging natural language processing, machine learning processing topics becomes not even come close, because the social media have the different platforms, and if you look at any machine learning algorithms, and they fell short of actually properly teased out such information. So there's lots of research potentials that you can do. You can do many PhDs in how to deal with, how to fast the processing those kind of data.
So obviously, so much work here, and with your passion leading the charge, talk to us about your team.
Okay, so we, as you can see, I always can see that in the beginning I feel misfed in trained as an engineer and end up in the computer science and in the school of public health. But that's a nature of the research has to be done this way. There's no other way. You cannot just having people sit in engineering or computer science lab study this problem versus the public health researchers looking at the disease model, looking at the best intervention. Would look at the behavior model and the sociology, psychology, and etc. And they sit separately. They have to sit together. So our team is always the multidisciplinary, and we work together. I was trying hard to always co-supervise my student, right? So then sometimes, and it's not Okay, so Jacob has to cut off this this line, I have to say, because this is not very it's not very favorable for your career. But cut off that line, okay? But then the multidisciplinary team and the work is very very important. So all my students have actually the co-supervisor from computing and from health.
Oh, and
That's
how
very
how big is
important.
your team?
Okay, so my team of, if you're counting on them, they are like a 5 to 10 people permanently here.
Right.
But actually, the community and the called digital intelligence for public health. It's a community, and if you go to our website, you can see there are multiple faculty members, okay, listed there, and they are very interested, and their students, and our students are all together. So Professor Zahed Bud, Professor Samantha Meyer, Professor Craig James, Perennial, and Jim Wallace and Joe Dubin, all these people have keen interest in data, and also particularly they have students or themselves are very interested in understanding how the social media data can inform us about the public, and actually how the methods we can develop, especially the AI methods we develop, can help us draw the insights on a much faster speed and a much better accuracy than we are doing now. So we can actually understand, do our research much faster.
And is this insight you're gaining right now focused Canada-wide, or is it now in other nations and second and third world nations? Like, how broad is this research?
Yeah. So in the correlation, now I'm not talking about my own research. I'm talking on behalf of that community of DI for PH, for public health community. And our research is not just related to Canada. Sometimes we want to. So like our latest publication is for Ontario very specifically. But sometimes we would like to do the Canadian-wide, and we also want to look at the comparisons of other countries. So, for example, Professor Perennial Maratha and Professor Zahed Bad, and with our students, and they actually collaborate with a dentist in Brazil, and they just published a paper about infodemics, about the things in Brazil. Right, so that collaboration now, never before, is just really borderless. And besides, also most of the social media data it's published. There's no border on there. Okay, so it is.
Well, this is really exciting. I'm just going to ask you one final thing to wrap up today. Then, so what's ahead? How do you see this? How do you see this whole health informatics, public health? All the AI research. What's ahead?
Yeah. So the AI research and in our at the School of Public Health, I was thinking about even within the University of Waterloo, particularly the AI in health part, and that they can take in many chunks of the research, and lots of my excellent colleagues are leading the charge. But in our own group, we are very focused on two things. And the one is actually the informatics with regard to very related to the public health at the population level types of intervention, and the data related to the population and the public health, such as the vaccination, their hesitancy, where are they, what kind of things leads to the vaccination hesitancy, for example. And so that kind of things is what we are very interested in. And eventually what we want to do is to really build a good AI algorithm. But of course, it has to be evolving continuously. And really to listen as a listener, thinking about if now we predict the earthquake or the typhoon or the tornado. You have lots of sensors on the ground. You listen to sense how the ground shaking and how the wind change, and then build a model and warn you, okay, tornado is going that way on your path, and you get better prepared. So we want also to look at if the social media, the signals we can listen from the social media, right? And to detect certain things coming. So currently our postdoc and the PhD was looking at if there is a correlation of the signals we listened in the social media and correlated the cases of the COVID as a kind of building our model and inform us there's a hypothesis that yes, we can have distill some signals from the social media data, and then we build end-to-end infovalence kind of surveillance systems, and we listen to imagine if there are lots of chatters, lots of signals coming, and if we can distill a certain meaningful signal, right, and then we can actually giving us a little warning or leads. And besides, also we are hoping to connect with a local or national, the hospital systems, the visits to the walk-in clinic, the labs of the certain pathogens, and the certain things suddenly have a surge. So if you actually look at this kind of connection and informing each other, and we will be much better prepared. Even just 7 days before the case hit your clinics and hit the local ER system, we will be much better off, right? So we can see, yes, so that is how we are working towards that goal of infovalence system, and using the social media signal and connect with some kind of aggregated data from the local hospital, and you actually having that systems, just like building warning systems for your earthquake warning systems.
Awesome. Well, this is great. I've learned 2 new terms today, infodemic and infovalence. So thanks again for joining our Let's Talk AI today, and you have a wonderful day. Thank you so much.
Thank you for having me.